Welcome, everyone. Thank you for joining us for today's webinar. My name is Lee Montville, and I'm the Director of Special Sales at Springer Publishing. Today, we are presenting Integrated Case Management, Enhancing Patient Care and Empowering Healthcare Professionals, with Rebecca Perez, Senior Manager of Education for CMSA and Executive Director for the Case Management Society Foundation. Before we get started, I wanted to mention that this webinar will be recorded, and if you miss any portion of this presentation, you will find the video on Springer Publishing's website 5 to 7 business days post-event. And we ask that if you have any questions during the webinar, that you please type them into the Q&A box on your Zoom control panel. Now, without further ado, we will turn the time over to Rebecca.
Thank you so much, Lee. It's a pleasure to be here, and I am so happy to have the opportunity to share more about this great book that we have put together and CMSA's efforts related to integrated case management. Integrated case management, or as we created an acronym of ICM, is an approach that empowers healthcare professionals. It enhances patient outcomes, and it fosters a culture of continuous improvement. The approach results in the ability to better navigate the complexities that some of our patients experience. Individuals with health complexity or challenges are challenged with medical, mental health, and social issues, which are overwhelming for them and prevent them from experiencing well-being. So today we're going to briefly discuss how an integrated approach accomplishes the ability to empower healthcare professionals, how it enhances patient care, bridges communication gaps, and promotes quality improvement. The recent focus on complex care models in the United States has resulted in a muddling of terms. Complexity, comorbidity, and multimorbidity are often confused or used interchangeably. So to be able to focus on complex care, the correct definitions have to be grasped. Comorbidity is a term often used to define complexity, and it indicates the presence of at least 2 health conditions that can be acute or chronic. But it does not necessarily indicate complexity. So for example, an individual with type 2 diabetes and hypertension that are well controlled, they're employed, they have strong social support, is not an individual that experiences complexity, although they do have 2 chronic conditions which always result in risk. On the other hand, an individual with poorly controlled type 2 diabetes, a hemoglobin of 9.2, blood pressure that runs an average of 170/95, a poorly healing foot ulcer on the right foot, they're unable to drive, they can't get to work, they're using all their paid time off, they may be looking at losing their job, they may face insurance loss and the inability to meet monthly expenses. This is an example of complexity. Multimorbidity is another term that may be used to define complexity. It's the co-occurrence of multiple chronic or acute conditions that can be medical or mental health in origin. Multimorbidity can result in complexity due to the number and severity of conditions. Complexity is multidimensional and often multifaceted. The individual experiencing complexity will have health conditions that are complicated by other factors such as those listed here: age and fragility, socioeconomic challenges, absence or limitation of cultural and linguistic services. Their environment may not be safe. Mental, behavioral health illness or cognitive challenges, health access challenges, or perhaps multiple providers in polypharmacy. Working with individuals challenged with complexity requires more time and effort if we are committed to helping them achieve health stability and improvements. The healthcare professional must be prepared for the high levels of interdependence and connectivity, competing and changing demands, unpredictability, and uncertainty. 5% of the United States population accounts for 50% of healthcare costs, and these individuals are challenging to manage. Individuals challenged with complexity may have multiple providers who are not collaborating. They may frequent the emergency department. They do not take their medications as prescribed. They have financial issues that make affording care difficult. They may dwell in unsafe environments, and they may have little to no available social supports. While certainly not an exhaustive list of potential challenges, these examples provide a sampling of contributors to complexity. And with complexity comes risk. Challenges to reducing complexity require determining the actual root cause and what concerns to address first. At the heart of an integrated approach lies the commitment to empowering healthcare professionals with essential skills and knowledge. Integrated case managers need comprehensive training that equips them to handle the multifaceted challenges they encounter in their role. By developing a deeper understanding of patient needs and the intricacies of care coordination, integrated case management professionals are better prepared to provide patient-centered solutions. But finding these solutions requires the ability to communicate holistically and effectively, focusing on what is important to the patient, developing trust to better engage the patient in self-management. One of the primary goals of an integrated case management approach is to elevate patient care and outcomes by providing a holistic view of the patient's medical conditions, social circumstances, and unique requirements. Armed with this comprehensive understanding, case managers can design personalized and targeted care plans that cater to the individual patient needs, leading to improved health outcomes and higher patient satisfaction. This is an example of a patient challenged with complexity. Based on these challenges, the case manager must decide how to prioritize risk for the development of a targeted care plan. So our case study is Sam, who has uncontrolled diabetes, a non-healing right foot ulcer with 2 admissions for infection and debridement. He's unable to drive. He has a history of depression. He does not adhere to a diabetic diet. He doesn't keep his medical appointments. He has a lack of social support, but does have a desire to participate in social activities, especially with his church. So for Sam, the priority risk is the non-healing foot ulcer, which has already resulted in 2 admissions. Without immediate intervention, the wound can be expected to worsen and could lead to more admissions or even potential loss of the extremity. His depression, lack of transportation to medical appointments, and poor social support were all interfering with his diabetes management. If his blood sugar is stabilized, we know that wound healing will follow. There are several issues which are contributing to Sam's poorly controlled diabetes and poor self-management. So this is an example of a targeted care plan. Sometimes with complexity, it's difficult to know where to start, and thus is the need to prioritize risk. Helping Sam understand the urgency to address the non-healing wound and how his poorly controlled diabetes are the priority. So we begin by reestablishing his connection to needed medical care. Then we begin to address the contributors. His depression and lack of social contacts are likely contributing to his lack of motivation to manage the diabetes. After the coordination of medical services to reduce the risk of a worsening foot ulcer or potentially other diabetic complications, we begin to work with him on the things that are contributing to his poorly controlled diabetes. So in a targeted care plan, we have the priority as the healed foot ulcer. And to do that, we want to make sure that we can secure appointments with his primary care and coordinate transportation, review his medications and his ability to secure those medications, discuss a wound management consultation with the primary care, and coordinate what is needed for that blood sugar management. We want to work with Sam on his diabetes treatment adherence, taking his medications, checking his blood sugar, following a diet, and keeping those medical appointments. Maybe we look at doing something like arranging meals on wheels until he can drive again, so that he's at least eating more healthy. We want to talk with Sam about these challenges, and perhaps if he believes counseling might help with the management of his diabetes. And then our next priority would be reestablishing his social connections. Ask him if he's comfortable reaching out to his church to see if maybe there might be some volunteers that would be willing to take him to services or other activities. If he's not comfortable, offer to make that call for him. If there are no volunteers available, maybe look at other community transportation options. And then talk with him about maybe reestablishing some of his other social contacts. All of these interventions probably will take a little bit longer, but at least we're paying attention to what's important to Sam while we're working on the clinical side of things where we know his greatest risk lies. Effective communication is a cornerstone of quality healthcare. An integrated case management approach emphasizes the importance of clear, efficient, and empathetic communication with patients and among all stakeholders involved in a patient's care journey. By honing communication skills, case managers facilitate seamless collaboration between healthcare providers, patients, and their families, fostering a cohesive and patient-centric care environment. Using methods like motivational interviewing help to create trusted relationships and ensure the patient is heard and understood. Communication is not always as easy as we think, especially with a patient that's challenged with complexity. In all likelihood, no one has ever done anything but tell them what to do. Patient engagement is essential if we want to help complex patients reduce their complexity. Trust and respect are non-negotiable. Yes, this takes time, but will result in better engagement. Listening is the number one skill we must acquire and then be able to truly hear what a patient tells us. These are just two examples of the methods that can help us better communicate. So in the manual, we talk about the patient's voice and we talk about motivational interviewing. Patient-reported outcome measures are not just a metric to tick off a list, but also a means of hearing what is important to the patient, and that data can be used to make improvements. Patients challenged with complexity almost always have health behaviors that need to be changed. But instead of telling them what to change, we recommend using motivational interviewing to help them discover this for themselves. If the patient comes to the conclusion that a change is needed and they gain the confidence to make the change, it's more likely to occur. Embracing a culture of continuous improvement is paramount in healthcare. Integrated case management training instills this value in case managers, encouraging them to identify areas for enhancement and implement evidence-based strategies. By adopting a data-driven approach to decision-making, integrated case management professionals can elevate the quality of the care they provide, fostering a constant drive towards better patient outcomes. So the key training points, which are based on the manual for integrated case management, is a willingness to address all of a patient's health challenges, and as such, a willingness to learn about the conditions with which you may be less familiar. It's important to advance communication skills for better patient engagement. We want to better understand the interconnectedness of health challenges through systemic evaluation. We also learn how to prioritize risk and care plan accordingly. But most importantly, we learn how to celebrate each success. All of these points have been mentioned throughout this presentation as unique to an integrated case management approach, But what is most important to remember is to celebrate those successes, no matter how minor. Every success helps to build confidence to tackle the next challenge. These successes belong not only to the patient, but to you, the case manager, as the trusted healthcare professional that has likely done more for the patient along their journey. Reducing risk is the desired outcome of an integrated approach. Complexity results in not just poor health, but inadequate quality of life, an increased risk of mortality, disability, and psychological stress. Internationally, case management and multidisciplinary team collaboration are recognized as the most common organizational interventions, especially in complexity. Identification of those that will benefit the most from case management intervention challenged with complexity may also be hesitant to engage with healthcare professionals due to distrust. That distrust may originate from a lack of respect, condescension, judgment, bias, perhaps little to no clinician demonstrated empathy, experiencing inequities, and poor health literacy with no attempts by professionals to improve. To expect engagement, we as healthcare professionals must make every effort to learn, understand, and demonstrate empathy, recognize and remove biases and judgments, and above all, demonstrate respect. Using a person-centered, team-based approach, integrated case managers examine risk in 4 health domains to better understand the patient's challenges. Once risks are identified, an integrated case manager can prioritize where that greatest risk lies, and then develop that targeted care plan that will reduce in risk reduction. These are the primary components of an integrated case management approach. To be successful and to promote improved health outcomes for individuals challenged with complexity. But we as case managers must invest in better communication skills, be open to addressing all of a patient's needs, examine and prioritize risk so that targeted interventions can be implemented. So at this point, I'm happy to take any questions that anyone might have.
Thanks, Rebecca. This is Lee Montville with Springer Publishing again. Thank you so much for a wonderful presentation. We did receive several questions. The first question is it more challenging to develop a comprehensive care plan and ensure compliance in a rural setting? Any particular recommendations?
So, yes, the answer is yes. It is challenging. And I think especially in rural settings, the challenges lie in resources, right? In being able to find providers, helping patients to access those providers. So a care plan for a complex patient in a rural setting will very much be much more challenging. But I think because we look at a systematic approach in assessing risk, you'll find using the integrated approach that it might not be as hard as it would be without, because the approach teaches you how to, as I said, systematically evaluate where risk lies, and then it can help you better, prioritize where you need to start working with someone first. So I hope that answered the question.
Yes, that did. Excellent. Thanks so much for that. The second question is, what makes integrated case management different?
It's different in a lot of different areas. So in my experience, as a case manager, as someone who has educated case managers, worked with case managers, it's my experience that depending upon the organization, oftentimes the case manager is that the the approach with the patient is very fragmented. There might be multiple people reaching out to them, multiple people working to coordinate care, and it may or may not be, um, you know, well, there might not be a good level of collaboration. So with an integrated approach, we're talking about one case manager, one case manager taking the lead in working with a complex patient. Now, there's expected collaboration between an integrated team or a multidisciplinary team, but to be able to better engage that complex patient, we have found that it's better that there's just one primary contact, sort of like some people call it a quarterback, that is making sure that everything, taking accountability that all of a patient's care gets coordinated appropriately, that they're accessing the appropriate resources, but that one touch, that primary case manager is better able to develop trust and a relationship. And we found that with complex patients, that's lacking. They don't really have somebody that they feel like they can, that they can relate to, that they can communicate with. They get confused about who does what, who am I supposed to call for what. And a primary case manager that addresses all of their needs helps to better engage the patient, and we're able to move them eventually towards self-management. But it's not easy. It takes time, but it does eventually end up with better outcomes.
Thank you. The next question we received was, how exactly does integrated case management support quality improvement?
Great question. So we have a method in the Integrated Case Management Manual where you can actually track risk reduction. We have a tool that helps you to prioritize that risk. And then as your care plan is targeted, you will see risk reduction. So you can actually use this tool as an outcome measure to demonstrate that your interventions have reduced risk over time. Integrated case management also supports value-based care. So all of the quality measures that are being looked at or being considered with value-based care are important to keep, that will help that reimbursement process. So the quality issues that are often addressed, an integrated approach is much better at helping those metrics be reached because of the relationship that you develop, because of the improvements that you can demonstrate, and patient satisfaction as well.
Excellent. And then the next question was, targeted care planning was mentioned. How is that different from traditional care planning?
So it's again, I'm gonna go back to my experience in working with organizations and their care planning. So especially with care plans that are auto-generated, or individuals who are taking every challenge that a patient experiences and creates a goal and interventions for that individual challenge. Targeted care planning examines a patient's challenges, all of their challenges. And then we concentrate on creating goals that are not actions, which oftentimes I see a lot of goals created as actions, or they're actually actions or interventions. So a goal is not an action. It's where we want to go. It's where we want to be. And oftentimes goals, they can be broad goals, but the interventions are very targeted with timeframes attached to them. So it's a little bit different way to think about care planning. But I can tell you that you can have a long list of challenges, and the number of goals to resolve those challenges is less because of the way we look at how to care plan. And we do work with case managers to teach them how to do that. But it is a very different way to think about care plan.
Perfect. Well, those are all the questions that we've had in the Q&A box, other than some people have asked about a certificate of attendance for this webinar. And if you're interested in a certificate of attendance for this webinar, please email my colleague, Gina Martinez, at gmar at springerpub.com for that certificate of attendance. And it looks like we've covered all our questions. So I want to thank everyone for spending time with us today. And thank you again to Rebecca Perez for a great presentation. If you're interested in purchasing Rebecca's book, CMSA Integrated Case Management, second edition, we are offering attendees a 25% discount using code webinar23 at the checkout at springerpub.com. For CMSA members, if you have any questions, please feel free to reach out to Rebecca Perez directly at CMSA, and her email is in the chat. And for anybody who has questions about bulk orders, you can reach out to me at LMONTVILLE@springerpub.com. So thank you again, Rebecca. We really appreciate this. We appreciate everyone who's attended today, and we look forward to seeing you at future Springer Publishing webinars. Have a wonderful afternoon. Bye.